All right, case number 8. Let's get ready to stumble. This was submitted by Emine Tunc, a Pediatric Emergency Medicine Fellow from Seattle Children's Hospital. Derya Caglar helped with the case. And we have a 13-year-old nonverbal male with trisomy 21 who presents to the emergency department with an intermittent decrease in left arm movement over the last 4 days, which started after a witnessed ground level fall. There was no head injury, no loss of consciousness, and he often falls due to gait instability. And his exam is challenging because his dad thinks he's in pain, but it's hard to tell. He was alert and pleasant, and he actually lifted both arms to give a hug to the examiner symmetrically. His strength was equal, and they could not reproduce any of this pain. His sensation exam was normal, but and limited, but they didn't find any neurologic deficits, and they got left arm x-rays, and those were negative. So they got cervical spine films, and this is what they showed. So, what's the diagnosis? Is this A, acquired torticollis, B, Grisel syndrome, C, atlantoaxial dislocation, D, idiopathic brachial neuralgic amyotrophy, or E, Sawara? And the correct answer is atlantoaxial dislocation. The radiologist incidentally called the team and asked if this was a post-mortem film because it showed a complete dislocation of C1 and C2. Little did he know that the still alive and jovial patient was just sitting in the room. So they laid him supine, they placed him in a cervical collar, and he got admitted to neurosurgery. He had a CT angiography and an MRI, and it demonstrated the dislocation along with some spinal cord edema. He underwent occiput to C3 posterior spinal fusion, and he was discharged after 1 week with complete resolution of his symptoms. Amazing. Here's the x-ray again. And you've got C1 outlined in yellow, C2 outlined in pink. Yeah. Atlantoaxial dislocation is a life-threatening complication of atlantoaxial instability, which up to 1/3 of trisomy 21 patients have. Any trisomy 21 patient with focal neurologic abnormalities should be placed in a collar until this has been ruled out. Acquired torticollis, which you've all seen, is a spasm of the sternocleidomastoid. Grisel syndrome is an atlantoaxial rotary subluxation, not dislocation, secondary to a pharyngeal infection. Idiopathic brachial neuralgic amyotrophy, aka Parsonage-Turner syndrome, which just rolls off the tongue, that's an autoimmune process and it presents with shoulder pain and weakness. And Sawara is seen in children with spinal trauma, cord symptoms with normal radiographs.